lecture that I did on the inauguration night. One of the important things that I highlighted was changing the mindset, because we all are trained to be doctors. So our training is about providing a certain healthcare service, either maybe in the curative sector or preventive sector. So our thinking process, right from the lectures to designing, say, tutorials, word classes, everything is focused on solving a problem, right? Based on a certain knowledge base. We rarely question that knowledge, right? We always think, okay, that is our mindset, right? So we have this knowledge. We get the knowledge from lectures and textbooks and all that. And then what we have been taught is to use that knowledge to solve a day-to-day problem. So the thinking pattern is different. But in research, as a researcher, this is all about questioning the existing knowledge. So the mindset change is the most important thing, right? So first have that in mind. Now, the second thing is what we do here as research is basically, this is Western science, right? People often get these things confused. So in Western science, that's what we practice and that's what we know about, right? So basically, the knowledge is generated via a certain mechanism that we call as scientific method, that we make observations and then we want to explain what we observe, and then we ask questions. Why this happening? What is the reason for this to happen? And then now we need to look for the existing knowledge to explain whether the existing knowledge is enough to explain my observation, right? So we search literature and then try to find out an explanation of my observation, right? Say a patient has collapsed, right? And now we observe that the patient's blood pressure is dropped, right? So now I need to, examine the patient as well as use my knowledge base to understand what has happened to the patient. It's the same thing, right? And then based on the existing knowledge, you have to develop a hypothesis, that is a guess, learned guess. This could probably be the cause for this observation. This is the reason. And then based on that, to test that hypothesis, you do experiments, right? So a hypothesis or a learned guess should be a testable one, right? So your question, your research question comes in not only at soon after observation, but even during building up a hypothesis also. This question is very important, because by experiment what you are trying to do is answer your question, right? So whatever the things that you do, like data collection, maybe experiment or whatever. Now I use this term experiment. We rarely do in hospital setup unless you do a randomized control trial or something like that, right? So this is what you do, and then you do collect data and come into conclusions and then share results by publishing, and then you see new questions, right? You might understand that I answered the question partially. There was this one group of patients had some problematic outcome. So why that happened? Then, that's a new observation. Then you start investigating again. So that is how the wheels rotate and how the knowledge is generated. So therefore, I think you understand that setting a question is a very important aspect. So, in my very few slides, the next one is about this setting the question. So usually the way we advise people is to start with the broad topic, right? Say now I'm pretty sure like some of you may have already having various research ideas, right, already. So if you have an idea about a certain research topic, first say that may be too specific, right? Because like your research question comes from your experiences, right? Your experiences, things that you observe. Your experiences may be very narrow, right? So maybe it's only relevant to Anuradhapura, right? So in a broader context, with a little modification of the question, what to do in the research may be applicable for many settings, many countries, right? So it's all about that is what I say by start with the broad topic, right? Should think about broad topic. Say if you are thinking about respiratory illness, right? Not specifically getting down into a certain patient in the ward or certain group of patients in the ward, like teaching hospital Anuradhapura. You have to step back and see whether, like, is this a big problem, right? Whether this occurs everywhere else, right? Is this because of a certain management step that is specifically done in Anuradhapura where other places doesn't happen? Do you understand what I mean? So you have to have a broad understanding of the topic, right? Otherwise, you quickly get into a pitfall where you do something that is very odd, only observed in here because of some silly thing done in here. You understand what I mean? So you have to have a good understanding of that. That is where reading is important, right? And then once you have this broad idea, right, and you have this preliminary reading, then only to narrow down, right, to a specific area. So if it is a respiratory illness, now there are many infectious diseases, non-infectious diseases. There may be like all sorts of different types, right? So what I am really interested in, right, narrowing it down to a certain group of patients, to certain age group of patients, certain sex, right? If it is an infectious disease, what infection? Likewise, right? And then at the same time, right, you should be able to answer the question as a problem. Then what sometimes people say like this: I want to study patients like this. A diabetes patient like no what to yalagana podi study ka karanno. Diabetes patient la, then it's like if we keep on asking what the treatment koi wage the wada karanne, you know what I mean. So it's basically very blurred. They can't really say or define what is the exact problem, whether it's a certain drug or whether effectiveness of a certain drug or compliance of a drug or maybe an adverse reaction or something like that. Because my point is, if your motivation to do research is just to publish something, then the easiest path is to get to the record room, drag some BHTs out, look at what is in the BHTs, and then take some data out and somehow do some data crunching, like analyze some data. Like often they come as audits. Do you understand what I mean? So they basically, that's my whole point. So basically, if you start doing that, what happens is, because you don't have a good research question already, now you are trying to somehow make a story based on a data set, right? So that is why your research problem, have you observed some problem in order to do a research, right? This process is very important. And then specific knowledge kept and justifying the research. So usually, so what? Sometimes when people present research, we ask, so what? So you should be able to justify the question, right? And then only, like after filtering through this process, then only the primary question and the secondary question. That is the most important question you want to answer from the research, and then the subsequent maybe a secondary question. That means the question, rather secondary level questions that should probably help you to identify you answer the primary question, right? So that is how it's done. So when I'm taking some examples, you will understand what I mean, right? So the key things are idea. what is your research idea? Are you already having an observation and you are having a hypothesis or something that you need to test, right? And then often people do about data, that is describe the prevalence of that, describe the incidence of this. Likewise, it's sometimes like when you plan research, sometimes say I want to see how common this disease A in our patient cohort. So it's just giving a number, right? You understand? So that kind of research is very limited use, right? So if you think of doing the board, doing research with board material, you may be able to identify, give a number. How common is it, and what is the pattern of patients over the years coming to the hospital? Well, you will answer and you will give a number, but for what? What is the purpose? Is that going to change the existing practice? Is that going to change, or improve the healthcare in the facility? So that you have to think of, right? And that is the exact way the journal editors look at this as well. When you send an article, first they see, is it worthwhile? No, then not significant. Doesn't that new to the existing knowledge base, right? So those are the things that we need to think. So question should be focused, right? And then it should be researchable and feasible. That means the answer should be provided. You should be able to provide the answer with research, and it should be feasible. Like funding, you have funding limitations, you have time limitations, right? Those things we have to think about before setting a question. Sometimes say, if you want to test whether drug A is more effective than drug B in a certain group of patients, the question is superb. But now, because you are looking at effectiveness of two drugs, what is the research that you need, type of research you need to do? Probably at least you have to do a randomized comparison study or randomized comparative trial, right? Now then, well, that is the design. You can design the study, but can you do it alone? No, then you have to think about, well, you may be able to do definitely. However, time strains, there are a lot of regulatory procedures that is going on, right? If specifically if the drug B is not being used for that indication in the setting before, maybe it's the drug B is again a drug frequently being used, but not for that indication, right? So then there are various regulatory procedures that you have to follow before starting a trial. So and it's not feasible. Do you understand what I mean? So basically, in that case, you may be better do some kind of an observational study or something like that, right? Like that, and then should be able to specific enough. The question should be specific enough to answer, right? Thoroughly. That's what I said in the beginning about in the question, it should be very clear what you want to study, right? Should be very clear. What is the outcome? Are you looking at an increase of blood sugar levels or decrease of control of blood sugar levels? If that is the case, how do you define that, right? By the time you set the question, say if you can't measure it, and if you are doing it with outpatients who are not in the ward or not under your control, then your question may be superb, but your monitoring is very poor. How do you do that? So those are the things you have to think at that time, right? And then, as I said, it's not about numbers. Should be complex enough, right? Not just by providing one yes or no answer, right? Not just by providing a certain number, prevalence or anything like that. You have to, the question should be a bit complex so that you can get more data, more information, right? Just then the data, and should be relevant, right? Relevant to the field of study. So these are this is kind of an outline, right? So just without wasting much time, like have you all kind of like grouped and formed group, or like what was the plan? Correct. So like now this is a discussion time, so it doesn't matter, like don't like feel like kind of ashamed or anything, like to come up with your genuine ideas, right? Because it's quite natural, we can shape up the questions. Do you have any research ideas? I'm not asking a direct question like what is your research question. I'm asking, have you thought about any potential research topics? Can any of you share with me and others? Now there's a problem, now genuine clinical problem. So you have made an observation, right? Now you have an hypothesis as well. This is how it happens, right? So basically, your idea is that faster the surgery, probably the the undesired outcome, right? That is what you feel, and your explanation is that, right? So now we'll start. Now you are in the ward. You are surgical SHO. Now, say you have some group mates as well. Now we have a problem. How do we shape up it as a research question? What is the best way? We can have a discussion, right? So any ideas? Now this is, now you understood his problem, and now he needs to, but your intention is to see whether okay, so that is the time taken for repairing the rectus sheath, whether that has any association. So that is what you see. Now, what about others? What others think about that? How that can be shaped up as a research question? Don't write. You don't need to write. Put it as a complete sentence. Just think what kind of research would be useful. Now he's a medical officer in a surgical unit. Definitely he has the access, right, to the patients. And then what would be the most useful way of investigating it? Okay, so occurrence of incisional hernia. So we have this large cohort of patients who are undergoing herniatomy, right? Hernia repair. And then there's this, and we have, say, in the BHTs, in the surgical notes, we have exactly, say there's somehow exact way of noting the time taken. And not only noting it, we have to have an understanding that it is accurately done, right? Because definitely, else you have to do a prospective one. That is, you start from now onwards and carefully monitoring. If you are going back, but the problem is, if it is a prospective one, how long would it take to get incision hernia? So that kind of studies are called cohort studies, right? So basically you set a question and observe the patients for a long time. They give very good, high quality results, right? Because you are not biased. Bias level is very low because you at the point of recruitment of the patients. That's a very good design, right, of doing it. So basically you prospectively observe. So then you have to kind of like get the patient's information or review patients maybe once in 3 months, every patient, and then see gradually over the time how it happens, right? So those are things that they have different techniques. That's another methodological issue. So they may have different techniques and there's skill level as well. Some surgeons may be skillful, some may not so, right? Some the there are lots of variations, and there may be some infections in the site that may adversely affect, right? There are multiple variables, right? So now, do you understand my point? Or else you can have, you can go back to previous patients, like, say if the medical records are available. Now then the problem comes whether the medical records are sufficient enough for you to get the data out of it. So in that, now you have a genuine problem. So are there any other suggestions of thinking of shaping up that idea? Maybe he's slightly altering his question. That is, now you are in this setting, right? Your hypothesis is yes. Well, there may be, people have done this in a rush and probably resulted this, right? So you step back and see, you review the cases with the existing problem, right? And see what are the causes for that. So say now in your clinic, now we have, say you do a study in the surgical clinic, present with this, incisional hernias for over, say 6 months. Patients are coming, right? And then you collect certain data that you think probably would have influenced the surgery, right? The outcome, right? And then you see how these things are prevented. What do you think about that? Will that sort? Will that answer his issue or problem? A good hypothesis. So basically, you do a kind of a preliminary study to get more information to develop a better hypothesis. But now now your research thing has doubled, right? So basically, you can't basically do 2 studies, right? So anyway, still, now you have changed the research question slightly, but then still you are finding something useful, right? There are, of course, weaknesses of retrospective data collection, right? And then how can you improve that? Like, whatever the data that you gather from, or validate your data gathered from a retrospective one. So say now Sajid wants to follow up patients who are attending to the clinic with incisional hernia. Now there can be whole bunch of whole bunch of different incisional hernias are there, isn't it? Like due to various causes and all that, right? So imagine that in your BHTs are perfect and they have everything in the BHTs. How can he still improve the study? Yes, increasing the sample. That means the number of observations you improve. What else? Think about different study designs. Definitely, those information has to be taken, whether the patient has like chronic coughs and all that, many other things that activates the cough and smoking and all that, infection and all that. Yes, that is about what data you are collecting. I'm asking the design. So this is not. I'm asking this. I'm talking now about designs, but it's important to shape up the question, right? That is a common mistake that people do. The people just grab data and try to do something and then end up with nothing. So basically, you have to have a clear idea. What is the easiest way? You are in a clinic. Have you heard about case control studies? So what are your cases here? Your cases are patients with incisional hernia, right? What about patients who have undergone the same surgeries but now not developed hernias, right? So if there's a way, somehow tracing some of these patients, right? And then compare it with the cases, right? Then they become excellent studies. you understand what I mean? So basically most of the bias can be eliminated. If you match age, sex, right? Say for example, now you have the list of cases, right? In the clinic, you start the study, and then within 3 months you collect 50 patients, right? So they have undergone different types of surgeries. Some of them are smokers, some of them have infections, likewise. And then you get the data set, right? And then you find out people who are probably matching with this, in your previous surgical list. And then what you do is you contact them and get them over and see whether they are not having, because they may be not presenting to you, maybe they may have presented to somewhere else. But then you can get age sex match group of controls. Now controls, if you look at the controls, probably like the surgical techniques, and because they are all like undergone like through the same system, isn't it? And from the same community and all that. Suddenly it becomes a very good research, right? So that is how you elevate it up to a case control study where now there's a good control, right? So now coming back to a research. So what would be the starting point? Now see, now case control, now you may say, imagine now you are going to publish that in a very high journal, BMJ or something like that. But then, well, having a case control, again, you see, getting them down to the clinic, and that lot of work is there attached to that, right? Now getting down a patient, say, controls are the most difficult things to get, right? They don't have a medical problem, so why they worry, come to clinic and show themselves, wasting their time and daily, missing their daily income. So that's very difficult. So usually funded studies, they have incentives. They pay 2,000 rupees, 3,000 rupees per day because as an incentive, right? So you need to have funding and all that. So now I showed you we discussed and come to a conclusion what would be the best ideal design for your thing. So it's a case control one. So your outcome is incisional hernia, yes or no. So now you have yes group and you get certain data out of it, and then you match the certain character variables in a control group and get them up here and get the data and compare, right? So that is the ideal. But is it practical in your capacity? It's actually practical with a large research group with funding, isn't it? So then now it all goes down to Sajid in the board. So what would be the practical thing? Ideal is case control. Probably it requires a lot of time and effort. Yes, I think descriptive cross-sectional study would be the best, right? So basically, you then try. You are not going to prove anything, right? You are not going to prove anything. What you try to do here is you observe these patients in a very methodical manner using a very strict kind of as much as possible objective data, right? And then, it's like an observational study to describe what do you want to now describe in this patient. So basically what you are now going to do is, so take another 1 year, and over this 1 year period, patients, or maybe 6 month period, depending on how common the patients are in the wards, clinics, those patients attending with incisional hernia, right? So what are you going to exactly describe in these patients? Now we are specifically now recruiting patients with incisional hernia. So now I'm asking, in these patients, there are lots of information. What are the information that you are going to get? Basically everything that, if you read a surgical textbook, everything that can trigger or gives rise to or result in your condition, right? And then some more, like not only what is described, but maybe other things, specifically like certain, now not the exact causes that a textbook would give, that should be included, but certain other socio-economical factors, right, that are not in textbooks, but you know that your community has, right? Those also should be included, and then do a descriptive cross-sectional study. Now based on that, you have to, do you understand what I mean? So now in that way it's more practical, but you are not going to solve the mystery, right? Now you have to compromise. Otherwise, case control study won't do it because of the feasibility. Now it's about now setting a question. Now think about how do you properly write down the question, right? You have to know that this is only about a patient with certain illness now, and now you want to see in your setting, in Anuradhapura, in your setting, right? What are the possible or potential factors that could give rise to this illness, potential, based on your judgment. So how can you increase the validity of your data? How can he improve the validity of data? Now this is a descriptive cross-sectional study. Increase the patient number. Well, he has 1 year and or maybe 6 months, and the number of patients that enter into the clinic is, well, that's fairly constant. What about going to other surgical clinics as well? So then in that way, what you do? You basically trying to negate various other factors like surgeon factors and things like that, right? Or maybe in that way you might understand there's this one SHO who does all these surgeries real fast, and his ones are the ones coming up with, this hernia. And then, right? So basically, that is that kind of. So those are when you have too many options, then you can have certain explanations as well. That is how you do. So you have to stop at a certain point. Now thinking of that, think about shaping up the research question. Do you understand what I mean? So things that you need to do. We'll take another example. That is your condition, and you want to check the your outcomes are attitude,
skills, confidence, and knowledge.
Attitude of what? Now the problem is attitude. Yes, what attitude? Knowledge regarding what? And
Regarding how the thing rather than admitting them, most of the time when the patient access some easier way is they are telling in the process police station or police officer. So there are most of the time within 3 minutes we can find a police officer. So rather than him identifying that there's a problem with this patient and calling ambulance, if we can attend and do CPR or then call the ambulance, that is more. That is the life saving. That is life saving. So we can we want to assess that change of knowledge and attitude.
okay. So
basically we plan to do now. First we go to police stations and assess their current knowledge. Then we arrange a training for them, and then we will reassess their knowledge and confidence factors.
So basically, there's this intervention, that is their training, and then you have pre-collected data on their pre-existed knowledge, and then after that you are testing it again there. So it's not like a behavioral change. You are not testing whether it now they can get a training, right? And their knowledge, certainly like any training, it will develop, right? Whether now you are trying to check the impact of that training. So
behavior included. because if he is confident about attending to a patient, his behavior will always.
Okay, good. So now the question is knowledge. Yes, there's this. Yeah, this is how. Now this is a good question to discuss because it's about the complexity of the question, whether you are testing different things at the same time and then shaping up it. So basically, knowledge. Of course, how do you test the knowledge? Yeah. Okay. Say now there are. We'll discuss the methods separately in another day. But okay, that's it. And then the other one, confidence. Behavior. Behavior what? Behavior how?
Behavior how? Before the training, if you see a collapse patient, you call 1190. After training, you will call 1190, but you will attend the patient and try to assess.
Yes, that's true. How do you test it? It should be tested in a real-time situation. So, that is a behavioral change. It's about how he acts in a real. So, what I'm trying to do is separating out the testable ones from the outcomes that are not testable, right? So sometimes when with interest, you tend to, include as many outcomes as possible, but some of them are testable, some of them are not testable.
Yeah, that is why I said now I'm not testing behavior here. Rather, I would test confidence. If the confidence is there, I would assume that his behavior will change and he would attend the patient.
Okay. So
most of the time they are not attending because of the they have no confidence and they have no knowledge. So that's why they are not attending and others are old. Yeah, assume that if we have knowledge and if they have practice, they can attend to.
Okay.
The problem is doing the publishing that literature that just that assumption has to be valid and it has to be true. Just a suggestion. We are doing an interventional study here. So what we can do is we are going, say one police station we are going, and we can have a set of a questionnaire or an assessment scale. So we can ask set of questions and give each police officer a grade to see the current level of knowledge on the BS. Then we do the training, and then we do the same assessment scale, and then obviously it will improve. But the problem comes that we are going to assess the impact on that training on the patient. We have to test that. So for that, one suggestion would be that it's complicated, but
Testing at intervals.
yeah. Now what we can do is you get one. First thing is they will give a 1904. Otherwise they will do the CPR. So if you are doing a certain, let's say in this area we are training the police stations. We can see the patients who have been go to the hospital who have been treated by the police officers, and then we can confirm that they have done the CPR and but then the problem is checking the impact.
Yes, so that's what I said. If your intention is to check the impact, otherwise what you are checking is whether your training course is successful, right? Basically, your training course has certain outcomes. That is, the trainee is undergoing various, having a certain level of knowledge, confidence and all that. So basically what you are doing is here, but its real impact, that has to be measured in a practical way. Like for example, with regarding the, say, based on the patients coming to the hospital through the same system, and then the ETU, and then how, looking at the patients, then how many of them were actually given CPR before or resuscitation before they were brought to the hospital by police officers, right? So likewise, so that's a complex design. So that in your study, I think most feasible one is to, now there's this program, pre-test and then post-test and see whether the test is, this program is successful. But if it has really change or impacted the outcome, then you have to have a data coming from based on the patients who are real patients who are coming to the hospitals, isn't it? That is the thing. So basically, then your question should be shaped up. Maybe testing the effectiveness of a certain training program in improving knowledge and skills and something like that. So basically, you can test the knowledge before and test the knowledge after. Then again, there are certain technical problems like, once you do a certain questionnaire before, you get used to the questionnaire. And then after that, post-test, you basically have the questions before. And when you are attending the training program, they are intelligent people, they try to find answers. But that's good. That is a learning process. We don't care how they learn. They learn somehow. And then, well, can. There are different ways of doing it. You don't need to necessarily use the same questionnaire, right? Different levels, you can do it, right? And the confidence level.
In previous we can go in some degree.
Yes.
But in the post-test we can go higher.
Yes. There are certain differences or changes that you can make when it comes to complexity and all that. That's okay. That's methodology. What I'm saying is that when you are setting the question, you have to now understand with regard to the feasibility. Your question, there's no problem. But with regard to the feasibility, you have to now compromise, right? Testing the effectiveness of that particular program, right? So it's about whether the program achieved its objectives in improving the knowledge and the skills and confidence as well. Like you can have a Likert scale or something like that. Ask the police officer whether how confident you are to approach a patient like this, to intervene, and how confident are you that you can do a difference to a patient like this. You got the point? So in that way, it's definitely an interventional study. You have a pre-test and a post-test. It's an interventional study. But interventional study, if we are to really look at the outcome, we have to look at the patient. There's a study like that going on, a big study, that is a safe storage project that is happening in this region. So basically they are giving not safe storage, vendor intervention. They are doing an interventional program for pesticide vendors in this area, right? And there are certain criteria that they give when there's patient like someone impulsively want to consume agrochemicals and with suicidal thoughts. They have they are given now a checklist, right? To check whether this person who's requesting this have certain characteristics, and if not, don't give, right? So that project is going on. So that is something like that, and they really look at the cases coming here and see how many of them, because it's a cluster randomized one. So they have randomized all the vendors in this region. So there are only certain vendors only, they have this thing, right? They are trained for this. Then they know from the patients who are coming here, right, with poisoning, they know exactly which vendor has, sold this, and whether that person could underwent this training or not. You understand? But the design is very robust, that they have randomized the small areas like up to Grama Seva divisions. So randomly selected those vendors. So the study is very robust. Do you understand what I mean? So if you are doing it, you can do it like that. So for police officers, you can do it like that. But then you have to understand the exposure. The exposure, whether now in a rural area, whether a police officer would similarly be needed for something like somewhere in an urban area. The Gamakanan police officer kenek onada. What is his role? But in a urban area, he may have a more bigger role. Do you understand? So those things has to be considered. Or else you can think, what about maybe like someone like some person in the village, right? Or someone like that, right? So maybe like allocating some people in the certain, you select some people from villages and then train them and see whether people approach them and do that, something like that. So it's all about what you maybe selecting someone else, a group that can uniformly approach people and attend to the situation.
We trained three-wheel drivers earlier in MOI just
Yes.
first day to request and even give them a sticker and a small certificate. But later on, we understood afterward because of the project which came to the hierarchy, and they don't have the equipment, but they have the knowledge about first aid afterwards. But to attend, they have to have the utilities.
Yes. So there are certain other limitations as well. So those are things that you plan. Sometimes like
feasible, so that talk about vendors who are selling pesticides. I'm a farmer. I'm going to you and you ask just a questionnaire.
No. It's not like a questionnaire. It's So there are a couple of questions that they want to judge whether this person is actively engaged in farming, and then whether that person is on impulse, like impulsively. Yes, very quick. Only couple of questions. I'm not quite like thorough with the exact questionnaire. I'm just commenting on their study. That is how they do.
Because otherwise, the farmers will know that he's taking much time. I'm going to listen and take my own language.
Yes. So those are things. But then that again proves now if that intervention works, isn't it? If he won't get that from that person, so that there's this other person who gives, right? So then it actually like based on the behavior of the subject, it actually probably like helps out the study. But that is so what I'm saying is that if you do like really trying to measure, now what you try to measure is a complex, difficult thing to measure, like people behavior, right? And then finally putting it as an outcome. So then you need to have a complex design like that to spot this. Otherwise, you will not be able to really finally come into a conclusion to link these two.
In remote areas, more than the police officers, the three-wheel drivers are in the
emergencies. Yes.
So other vehicles, even they don't try to transport, only the three-wheelers will be available. And they will like to transport.
Yes. So that's, so that is, so maybe like you kind of think probably like police officers probably may not be the ideal. If not, then if it is three-wheel drivers, how do you do it? Maybe like select Anuradhapura area, a small area like urban area, and then certain three-wheel parks you do the training and certain not, like by randomizing. And then see how from that area, like say, so there are maybe certain cases, say 200 cases that requires this, right? Of them, say 80 were attended by three-wheel drivers. And then see of that 80, how many because if you have correctly randomized that area, right, three-wheel parks, then see how many of them were actually resuscitated by the three-wheel drivers who underwent this training. And then also you have to prove that those patients did better than otherwise, like then it's not going to help. So that's like so basically in that kind of complex study you have to get into that.
Better option is to go over this. Describe the degree of knowledge and attitude the police officers having.
Yeah, it's not actually descriptive. Then it's you are testing a certain intervention whether it has achieved its objectives, right? Certain objectives.
No, I'm telling without intervention, without that training part, I'm just assessing.
Yeah. That's true. That's I think that's more useful. Then you can have you can do a survey, right, with a very good toolkit and then you can like get their opinion as well, whether they think it's useful and all that. So then accordingly you can plan a intervention, and then after that you can do a pre and post test like that, right? So that is because now you have a purpose. That is, you need to develop a program, and then you kind of try to get some information from them whether there's a necessity. Any other? Study, so basically now you don't need to really do an intervention, because now the practice is different. You are now taking a group of patients and see the two different practices have given two different outcomes. So, and then, okay, so retrospective, that in retrospect, recording in a ETU setting, yes. And then whether it's objective, yes, anaphylaxis, there's a definition, and you basically document whether the blood pressure and the saturation and all that. And basically now patients can be defined, like, right. So what is the, so that's a very straightforward one. It's a very straightforward one. What are the things that you probably, like when it comes to specifying the question, what are the things that you would probably consider? Now, be more focused on the type of patients.
Yeah, I think we have to select the same brand of AVS. I can trace it from window.
Why you want to restrict it to a certain brand?
I think it depends on the brand.
Yes. Now, whether it's been so Bharat, now why don't you collect all the patients and see a subgroup analysis and see whether there's a difference between the two brands. Okay, so that is a factor that you concern. What else about other things that you need to think about the specificity or specific nature of your patient group and all that?
The patients is having anaphylaxis, the past history of
Okay. So those are data collection things, like basically with regard to the information that you collect from data. But I'm asking like certain specific patient groups that you need to know. Like, so anyway, now these are going to be patients who are directly being admitted to here without probably not having had antivenom beforehand, like, and then yes. So basically, that's a good research concept. Now it's about, because it's very straightforward, it's measurable, right? And the setting that she works in documents everything, right? Because it's an emergency setting, so that the reliability that attached to that data is actually quite reliable. And then do you document brands?
No, I can trace it from the usually these days only we get one brand, I can't remember the name, but I can trace it from the what we get.
All right. Now you can get data from us, because each patient, when the antivenom is given, we attach the label to data sheet. So we have the data of everyone who giving antivenom and getting the brand and batches and everything. So that's a good way. Now that, I mean, like, otherwise, outcome wise, you have the information. Yes. So what is the research question now?
Whether there's any reduction in getting anaphylaxis with the increase in dose of adrenaline subcut as a pre-medication.
Okay. So the determining factor is the adrenaline dose subcut, right? And then, are there patients? Now, if you draw a Venn diagram, there's this whole group of patients receiving antivenom. Some of them will receive adrenaline. Not all of them. In the protocols,
We are giving, all of them we are giving subcut and adrenaline. but some are practicing 0.25 and some
So,
are
but anyway, everyone getting advantage. So then like the whole group of patients, like maybe like not 1-to-1, maybe like 0.5 in a smaller fraction compared to 0.25, but still you may have a comparable number because about like 200 patients, 150 patients per year, maybe 200 patients receiving antivenom. So probably large number of patients. And then you may probably, what about like patients who are receiving antivenom at the ward, not in ETU setting, or you want to?
Usually here, all the patients are going through the ETU, snake bite.
Okay. Only very few.
Only few, if they go, if you get any envenomation features in the ETU and if they are going to ward and after that, you know, only that patient.
Right. Yeah. So in that's a feasible study, well within the hand. Do you understand? Now I don't know whether you. I hope you carefully listening. So those are the things. I think 3 different type of research ideas, and when it comes to feasibility, they differ a lot, right? So when you plan out the research question, you have to think that. Now, for example, see the impact. If you look at the impact, your one is not a setting dependent one, isn't it? Whatever the findings that you come out with would likely to be generalizable across the other hospitals as well as in some other countries as well, right? Do you understand? So basically, that is where you have to become smart. You have to be smart. Sometimes you put a lot of effort in doing certain work which are only kind of important in this setting. I'm not saying that they are inferior. They will change if they are. I mean, sometimes they might change the outcome of patients in another, but that's okay. But as a researcher, you have to weigh out these things. Now, that is a good idea. So basically, whether the dose of pre-med adrenaline has any effect or incidence. Not incidence actually, it's a prevalence of acute adverse reaction or maybe anaphylaxis, definitely among the patients who receive antivenom. So basically the dose of antivenom in the initial dose, that is the same. So you can exclude all these things and do. So any other problems? I think now it's 1.5 almost.
I'm working on the surgical unit here, and we have implemented sort of an electronic health record system in our setup. So in parallel to the paper-based system, we are collecting patient data digitally, and our data lists are digitalized, and rather than managing it on a diary, we are using a digital platform. So it's more of an audit, but now what we have done is we have done a literature search as well about the electronic health record systems implemented in Sri Lanka. There are quite few, and we have compared the outcomes in those things. And we have, like, from our system, we have noted that it improves the overall quality of care, and more significantly, reduce the patient diagnostic delay in cancers. We are trying to get into a research question. Publish that. Initially, we thought of going for implementing a electronic health record system in a tertiary surgical oncology setup as a pilot study. What we are struggling is it's more than in a level, it's like an audit. There's a deficit, and we are trying to get that into research.
So, why did you adopt this system? What was the reason?
Simply because it's difficult to track patients on the paper-based system, and then because we are following up patients for a long period of time.
Hold on. So basically, now your reason, now you did is because of a reason. Now you know the reason. whether that reason, does it still existing after implementing that? That means whether it has worked. So what are the parameters of you judging that it has worked?
One thing is when sometimes when patients who have been following up for a long time, they come to the clinic without previous records. But in the digital system, all the records are scanned.
Yes.
So if they are, we can assist. And other thing is we
so that's kind of like, now the system is there, it's available. Basically, you don't need to do a research to do that, but
yes,
you have it.
yes.
Yeah, okay. But that's an important thing. I'll come to that later.
And when we a patient comes to the first time with a complex cancer or something, and we do a multidisciplinary team with that. And then we want to trace the patient and contact them and do something like that. And we have the system. In that system, we have all the patient's data summarized for the MD. So then we access the data through that system. The other thing is the theatre list. Usually when we assign it, it's written on a diary, but now it's digital, so anyone has remote access. The ones who are given access.
Okay, now basically what you said was whether the database has done its work. You set up the database or the system because of a certain idea, because it is useful. And then now you say, well, the exact reasons why what you expected, or the objectives that you had before establishing it, now they are covered. Now, what is your research question? So you established this, you had some, you really wanted to do that, and now it has this everything in the system. So now think, what is important for the other people? So the question, this one, so what? Now there's a system, you did it very good, so what?
All the benefits now, like I said, the review. So they have different areas in the country. Up north, they have one system. So they have done focus group interviews from the healthcare staff and obtained data regarding how feasible it is and how much less burden it is for them. Things like that. But the most important significant factor that has come out of this system is the reduction of diagnostic delay.
Okay, so that's an objective one.
Okay.
So if it is an objective one, say previously how long it took for diagnosis, and then now for patients how long, how fast you diagnose. So now there may be like data, right, in patients' records. Is it something that you can prove from the data?
Have you thought about the diagnostic delay as well as the treatment in the system?
Treatment delay per se is something that we manage. It's a different aspect. We were just thinking about the previously, the patient gets a biopsy and then the biopsy goes and it comes to the clinic in about 2-3 weeks time. Then the patient comes to the clinic again in another 3 weeks time. But using the system, if it's a malignant, we get a notification that it's malignant, so we can call this.
But still, it's recorded
yes.
in patients'
yes.
Like clinic book as well as in your system, so that you can work out for the diagnosis and for the treatment how it has changed. That is done. That is data. So my point is this. So is that all?
There are multiple benefits that what we are struggling is to make that a research.
Exactly. So I'm asking, what else? Now data. Then අපි වැඩක් කරන්න හේතුවක් ඇතුවනේ.
I just can propose like this. They have paper-based system, and now it is digitalized. So they can compare with that, because now the paper-based, if you want something, we can provide you the researcher. I can provide you the paper-based system. Or are we giving the open access to the researcher if they are the researcher medical audit? Can they access to your system?
One other aspect often people forget is you try to prove something with data. That is the problem. Do you really want to prove something with data? So who is the user of the system? Who are the users of the system? End user. Yes, healthcare staff. And who are the people who are benefiting? Patients. So how do you get whether information, whether the users as well as the benefit, people who are getting the benefit are happy at the end? How? So that is the part. So data, yes, you show, because that's a very good question. This is where qualitative studies come. You do focus group or in-depth interviews with users, the doctors, the medical staff, and see, get their own experience, right? There's a lecture on qualitative studies, right? So basically, these are about individual experiences of people. We can't actually turn them into numbers or digits, but they are highly important, right? So the ideal way is you get some quantitative data, that is the diagnostic time taken for diagnosis as well as treatment, right? That is numbers. In addition to that, you can do qualitative research. That is, you interview patients as well as service provider and see how do they feel. A doctor might say, I have seen many, hundreds of patients before, and they are going everywhere, and they are, there's big delay in the process, but this thing has made it easy, right? So now many of you might be thinking, now this guy has been talking about all these objective measures, and all of a sudden now getting down to individual experience, very subjective things. Why is that? So that is the other side of big research, that is qualitative. There are certain things that we can't express from quantitative or numbers, right? Especially satisfaction, patient satisfaction. There's a big area called social science research that is based on qualitative, right? For example, say, if you read a textbook about, say, patient care written in Western world, and sometimes the way the patient perceives the care given by the hospital is completely different if you compare the patient in our setting, whereas in UK, right? The way they feel about their disease, the way they interpret the happiness level, right? Sometimes our patient may be quite happy even if you don't scold the patient, right? So basically, that is his ultimate goal. You know what I mean? So basically, those things can be captured. I'm not, limiting to that. So the best thing is use that quantitative data as well as do some interviews. In-depth interviews where to see whether the end user has actually are happy, and the people who are getting benefit are happy, right? So basically, it's a kind of a mixed method study. We call them mixed method study, where you mix the quantitative as well as qualitative to see the system has worked, have improved the patient care, right? So basically, you are now with that case, you are showing with the data as well as from qualitative data that the patient outcome has improved. You understand? So I think now if 1:30, I would probably wind up the session now, because this lecture, this kind of discussion can go on for days, because it's because there are lots of different things, but I think we got some nice 4 examples in different scales. Now I think with that you can actually start thinking what is more possible, and this you can read about qualitative research, and there's a lecture. I think I'm not sure there's Dr. Nuwan probably doing it, right? That's again a very good type of research that you should be aware of, right? Not just the numbers. So any other urgent questions or anything else? Anyway, now I think Sajid and you guys, anyway, you have a plan to get yourselves allocated into different groups, and then we will probably allocate one researcher to help you out for each group, right? To then you can shape up the question as well as the methodology while it's happening. Is that okay? Yeah. Okay. So then, thank you very much.